Well, today we were talking about selecting patients with lung cancer for who should get an inhibitor of the epidermal growth factor receptor. And there are small molecule inhibitors such as gefitinib and erlotininb that are sold as Iressa and Tarceva, and there's an antibody called cetuximab that's sold as Erbitux. So for first-line therapy, the standard for lung cancer patients for many years has been to give 2 cytotoxic chemotherapy drugs, which of course have to be given intravenously and have lots of side effects. And the question is, are there some patients for whom a pill, gefitinib or erlotinib, would be just as good or better? And the studies that we and some others have been doing have shown that for certain patients, the pill not only is less toxic and better tolerated by the patients, but actually better in terms of response rate, progression-free survival, and survival. And these are patients that can be identified by the fact that they have a mutation in the EGFR gene. So for people with an EGFR gene mutation, the preferable therapy is to receive a pill rather than multi-agent chemotherapy. Now, that's really a paradigm shift because it means you have to get the patient's tumor and test the patient's tumor to see if they have this mutation or not. So a trial that we recently completed looked at getting this pill, erlotinib alone, or getting the pill alternating with chemotherapy. So the idea is that this pill arrests cancer cells in a particular phase of their cell cycle growth called G1, and some of the chemotherapy drugs kill cells that are dividing. So if you could arrest cells and then release that arrest and get them all dividing, the chemotherapy might have a better effect. And it turned out that that hypothesis didn't work, and it was best for the patients that had the mutation to get the pill, still better than getting the pill and the chemotherapy in this alternating manner. Going forward, there's a couple challenges. One is these trials that we've been talking about are people with the most advanced stages, stage 4 disease. Well, how can these pills be applied to earlier stage patients? Should patients get them before surgery if they're early stage, or after surgery? If it's after surgery, should they get chemotherapy followed by the pill, or just the pill? Lots of studies, lots of challenges for the future, but really exciting results. You know, I personally believe that cancer research in general is underfunded, especially in these times where economies aren't so good. This is a win-win situation. You could employ people, find discoveries that would start small companies that would stimulate the economy. And I don't think you would be wasting, monies. In lung cancer in particular, of course, it's the most common cause of cancer death in the world. I'm sure in the UK and in the United States, it's the leading cause of cancer death. And the amount of money that we spend on lung cancer research to breast or prostate cancer, some other cancers that don't lead to nearly as many deaths, is very small. So personally, I think a lot of extra money could be spent on lung cancer without wasting a penny.